guys, you are welcome to DSSG Nation. So if this is your first time watching a video from DSSG Nation, do make sure you subscribe and you hit the bell button so we can notify you whenever we create a video. So today we are going to be talking about the complication of diabetes type 1 and type 2. So the acute complication, which is what? Diabetes, ketoacidosis and hyperosmolar hyperglycemia syndrome. So stay tuned. Yeah, welcome back. So we said we are going to be talking about the complication of diabetes. So the complication of diabetes are divided into two. So the first one is called the acute complication, and the second one is called the chronic complication. So for the acute complication, we have two, depending on the type of diabetes that the person is suffering from. So if the person is suffering from diabetes type 1, the complication, the acute complication for diabetes type 1 is diabetes ketoacidosis. And for type 2, the complication for what? For diabetes type 2 under acute is HHS. Hyperosmolar Hypoglycemia Syndrome. So for this chronic, we have microvascular complications, and we also have macrovascular complication. So these are the complication of diabetes. So a quick recap: we said it can either be acute or chronic. For acute, the type 1 diabetes, the acute complication for diabetes type 1 is what? Is diabetes ketoacidosis. They used to call it DKA. And for the type 2, the acute complication for diabetes type 2 is Hyperosmolar Hyperglycemia Syndrome. So they used to call it HHS. So for the chronic, the long-term complication, it can be microvascular complication or what? Or macrovascular complications. So we are going to be talking about the chronic in another video. So today we are just going to deal with diabetes ketoacidosis and hyperosmolar hyperglycemia syndrome. So stay tuned. Yeah, welcome back. So let's start with diabetes ketoacidosis. Diabetes ketoacidosis. Now, in diabetes ketoacidosis, what used to happen? We said it's a complication of diabetes. And in diabetes, we have what? Hyperglycemia. Hyperglycemia. But why do we have hyperglycemia in diabetes? Because there is no insulin to do what? To bring in the glucose into the cells. So there is no insulin to open the cell for what? For the glucose. So they are going to accumulate in the blood. So this is going to lead to or increase, and that is glucosemia, and that is blood. So there will be a lot of glucose within the blood. So this glucose will not be able to move into the cells. And the function of this glucose is to do what? Is to give energy to the cells. And now, after hyperglycemia setting, what is going to happen? Diabetes ketoacidosis is going to set in. But how? Since the body cells, they are unable to do what? They are unable to gain energy using glucose. So they are going to break down their fat. So their fat stores. So they are going to break down their fat stores to get energy. And when they break down fat, this process is called lipolysis. Lipolysis. The word lip means lipid, which means fat. And the word lysis means breakdown. So our body system is going to do what? It's going to break down the fat store. And when it breaks down the fat store, it's going to produce fatty acid. As we all know, the fatty what? fatty acid. And when it produces fatty acid, after this body system, when it undergoes lipolysis, it's breaking down the fatty acid. What is going to happen? This fatty acid will go into the blood, and from there it's going to reach the liver. So they are going to reach the liver, although some will still be in the blood. We are still coming back to that. So they are going to come towards the blood and then reach the liver. So the liver is going to use these fatty acids. So the breakdown of fat, the fatty acid, is going to use this fatty acid. It's going to use it to do what? It's going to use it to produce what we call ketone in a process called ketogenesis. Ketogenesis. So genesis means beginning, cause, or production, while keto stands for the word ketones. So ketogenesis is going to occur with all these fatty acids. So ketone is going to be present in what? In the liver. And now the liver is going to distribute it into the blood. So it will go into the hepatic vein, as we all know, and then the hepatic vein is continuous to the what? The inferior vena cava, which connects to the what? With the heart. So if you don't know that inferior vena cava is continuous with the hepatic vein, just go and watch our video on the description of the heart. So a quick recap: we said our body will attempt to produce energy by breaking down the fat in a process called lipolysis, and the fat is going to give us fatty acid, which will go into the blood, and then it will go into the what? Into the liver. And then the fatty acid is going to do what? It's going to be used by the liver to produce ketones in a process called ketogenesis. And now ketone is going to go into the blood, and then into the body system. So our body is going to be using ketones as a form of energy. So ketones will be the what? Ketones will be as a form of energy. Ketones will be, ketone will be used for energy rather by our body cells, because our body cells, they can't use glucose anymore, because glucose is not rushing into the cell. So our body will be picking up ketones, so it will be using ketones as its energy. But this ketone is acidic, it's a weak acid. So because it is a weak acid, it is going to do what? Now remember, from our scale of pH, we have 0 to 14, and the neutral being on the 7. So now, because ketone is now depositing in the body, it is going to tilt the what? It is going to tilt the pH scale below 7, and that is going to lead to acidity, because below 7 is acidity, and then above 7 is what? Is alkalinity. Alkalinity. So let me clean the board and start again from the ketones level. So stay tuned. You are welcome back. Now, we said in diabetes ketoacidosis, our body is going to be producing energy using fat. So we call that process lipolysis. Our body will be breaking down the fat in a process called lipolysis. And then the fatty acids, they are going to go into the what? Into the liver. And when they go into the liver, they are going to form ketones in a process called ketogenesis. And then ketone is going to do what? It's going to travel out of the liver into the bloodstream. So that the ketones can be picked up by our body to use as what? As energy. So our body cells will be using ketones as a form of what? As a form of energy. But I said this ketone is acidic, and we said the normal pH of the body is just within the 7, the range of 7 point something, 7 point something. So not even up to 8. And then here is alkalinity. So 7 to 14 is denoting alkalinity. And then 7 back to 0 is denoting acidity. And because ketone is acidic in nature, the accumulation of ketones within the body is going to bring about what? Reduction in the body pH. The body pH is going to do what? The body pH is going to reduce. And when it reduces, this is going to cause acidosis. But acidosis, which results from what? It results from the deposition of ketones. So it is called ketoacidosis. But this ketoacidosis, what leads to it? That is what? Diabetes. That's why they call this complication diabetes ketoacidosis. Now, since there is deposition of ketones within the body, what is going to happen next? So now, what is ketoacidosis? What is it going to cause to the body? So let me just clean the board and start with that. Stay tuned. Yeah, welcome back. So, for the pathophysiology of diabetes ketoacidosis, we said these ketones, they are going to do what? They are going to be formed. So the body is going to be using them as a form of energy. But because these ketones, let's look, okay, this is the liver now. The liver. So ketones have been formed, right? And the body is using it as a source of energy. But with constant breaking down of what? Of fat, which is leading to ketones, this is going to lead to increased amount of ketones within the body, called ketoacidosis. Because ketones, the ketone rather, is acidic. So the ketone is going to go into what? It's just going to go into the hepatic vein. Let's do it here. The hepatic vein. So we're trying to lead the liver to pass through the hepatic vein. Now into what? Into the inferior vena cava. Inferior vena cava. And from there it's going to go into the heart. Into the what? Into the heart. So when it flows into the heart, this is the heart now, right here, just a sketch. So it's going to move into the what? Into the heart. And then a lot of ketones goes into the what? Into the right ventricle, then into the what? Into the pulmonary artery. So it goes into the pulmonary artery. So it goes into the what? Into the lungs. So because it goes into the lungs, we know that ketone is moving like this, right? So the ketones is going into the lungs. So the volatile aspect of ketones, which is called acetone. So it's going to go into the lung. So they are going to go into the lungs rather, and they are going to pass out through what? Through the expired air. So acetone is going to do what? It's going to pass out through the expired what? Expired air. And this acetone has a characteristic fruity smell. So you can also call it a sweet smell. So the person is going to have a characteristic fruity smell. So when the person is breathing out, the smell will be very sweet. And that is another sign, and that's another sign rather for what? For diabetes ketoacidosis. So after that, the blood is going to come back to the heart and the lungs, right? So if you don't understand what I'm doing right here, just go and watch our video on the heart, you will understand. So the blood will flow back into the what? Into the left atrium, then to the left ventricle, and then upward through the aortic valve. Now it's going into where? It's going into the aorta. So when it moves like this into the aorta, we know that this arc of aorta is supplying the upper part of the body, and that includes what? It includes the brain. So that includes the what? It includes the brain. And now, when this blood that contains a lot of ketones, when it gets to the brain, it will be able to cross the brain barrier, because you know that the brain is well protected, that as in nothing can just go in and come out. So it is well protected by the blood-brain barrier. But ketone is very strong and it's going to do what? It's going to deal with the barrier, it's going to enter the brain. And when it enters the brain, a certain point of the brain, a certain region called the medulla oblongata. So the medulla oblongata is going to increase the respiration of what? Of the individual suffering from this disease, suffering from this complication. So, and then what is the medulla oblongata going to tell the body system of that person? It's going to tell the body system of that person to increase the respiration. To increase what? To increase respiration. And why? Because these ketones can be expelled out of the body using what? Using air, the volatile aspect, the acetone. So the person is going to increase the respiration. And this kind of respiration will lead to what we call cosmos respiration. Cosmos respiration. So that is the kind of respiration that the person will have. So after that, you know that the ketone is going to flow down with the blood. So into the what now? Into the descending aorta. Descending aorta. Into descending aorta. And from there, it's going to branch into the abdominal. It's going to form the abdominal aorta, which will branch later into what? Into the right and left renal artery, which supplies the kidney. And then a lot of ketones, a lot of blood with ketones will enter into the kidney, and then the kidney is going to pass the ketones out. So, and that is going to become another clinical manifestation called ketonuria. So, that's another clinical manifestation. Now, a quick recap on this. We said after ketones are formed in what? In large amounts, they are going to move into the heart, and from there into the lungs. So the volatile part of ketone, called acetone, is going to be expired out with air, and the person is going to have a characteristic fruity smell because acetone is sweet in smell. So, and after that, it is going to do what? It is going to move back into what? Into the left atrium. So through the pulmonary veins. If you don't know this, just go and watch our heart, and then it's going to move into the left ventricle, then into the aorta. So the arc of the aorta supplies the upper part of the body, and because of that, what is going to happen is that the upper part of the body, brain also made up the upper part of the body. So within the brain, this ketone is going to cross the brain barrier. It has the ability to cross the brain barrier, and then it's going to affect the brain. It can even knock the person unconscious. But I just want us to pick the medulla oblongata there. So the medulla oblongata is going to sense high level of ketone within the blood, and then the medulla oblongata, it has the respiratory center within it. So it will increase the person's respiration, and the person will have what we call the Kussmaul's respiration, a rapid respiration, in an attempt to do what? In an attempt to get rid of ketones. And after that, we said the blood will flow downward through the body, descending the aorta. So at the thoracic region, it is going to form the thoracic aorta. I willingly left that place unsaid because what we are going to is just the abdominal aorta. So the abdominal aorta will branch into the right and the left renal artery, which supplies the kidney. And then the kidney is going to get rid of ketones as well in urine. And that one is called ketonuria. So with time, the presence of glucose within the blood will lead to absorption of water back into the bloodstream. I've said this in our last video, just for what's called diabetes. So because there is a lot of glucose within the blood, it is going to perform the function of osmotic diuretic. It will draw blood back into what? Into the bloodstream. Sorry, it will draw fluid rather from the tissue space within the body. It will draw it back into the blood. And because of that, the person is going to lose weight, the person is going to be dehydrated. So all this water drawn back into the blood vessel is going to be given to the kidney, and then the person will have what? Polyuria, which is another clinical manifestation. Polyuria. And because the person is losing a lot of water through urine rather, so the person is going to be what? Is going to be dehydrated. I've talked about that. The person will have sunken eye and other sign of dehydration. So, and after that, the person will feel an excessive thirst for water, and that term is called polydipsia. Polydipsia. So the person will be taking in a lot of water as well. So this can mark the end of what? Of diabetes ketoacidosis. But we can't just stop it if we don't talk about shock. So the person can go unconscious. So how can all these processes, how can it lead to shock? How can it knock the person unconscious? Now, I've said this that ketones can disturb the brain and the person can lose consciousness. So that is that for unconsciousness. But another thing is that these ketones, it can affect the blood vessels and it will make them dilated. And when they are dilated, there will be what? There will be not enough venous return to the heart. So the person can suffer from shock because there will be there won't be enough blood supply to the body tissues because of the vasodilation. And that is that for what? For diabetes ketoacidosis. Now let's run straight to the second complication, which is called Hypersmaller Hyperglycemia Syndrome. So stay tuned. Yeah, welcome back. So we said we are going to be talking about Hyperosmolar Hyperglycemia Syndrome. Hyperglycemia Syndrome. Can also find sometimes with the put hyperglycemia first, like hyperglycemia hyperosmolar syndrome. But what's the meaning of this? The word hyper, it means high or increased level of something. The word osmolar is talking about the osmotic pressure. And what is the meaning of osmotic pressure? If you don't know this, just go and watch our video on capillary bed. So, osmotic pressure is a kind of pressure that works within the capillary bed. So, it draws in fluid back into the what? Into the bloodstream. So, if this is the capillary bed, for example, just for example, and we have the cells right here, cells that wants to feed on glucose or anything. So we know that this capillary bed is supposed to have pulse. So the fluid that are within this place is called the tissue space. All the fluids that are air. It is osmotic pressure that brings them back into the what? Into the blood. So osmotic pressure, it draws in fluid back into the what? Back into the blood. So the word hyperosmolar means increased osmotic pressure. But what is the meaning of hyperglycemia? It means increased level of what? Of glucose. We've known that. So it means this increase in osmotic pressure is as a result of hyperglycemia. Is as a result of increased glucose level in the blood. So it means whenever there is a lot of glucose within the blood, if you have a lot of glucose within what? Within the blood, the glucose is going to be drawing in water from what? From different body parts, from the tissue space to be precise. Tissue space to be precise. So glucose can perform a function called osmotic diuretic. So now we've known the meaning of the osmotic now. It increases the what? The osmotic pressure within the capillary bed. So syndrome. Syndrome means a combination of signs and symptoms that present itself as a disease. Now, since we know that presence of glucose within the what? Within the blood will lead to what? Increase in osmotic pressure, and that will lead to what? Accumulation of fluid within the blood vessels. So in hyperosmolar hyperglycemia syndrome, this occurs in diabetes type 2 rather. So the glucose is going to draw in what? It's going to draw in water. That is the word osmotic. And now this diuretic means loss of water. So when it draws in all this water, it's just going to give it to the what? To the kidney. And then the kidney is going to pass it out in what? In urine. And that is what we call polyuria. So, because the person is losing a lot of water, the person is going to have the sign and symptom of dehydration as well. So, and apart from that, the person is going to suffer from what? Polydipsia. Increased intake of what? Increased intake of water. Increased thirst rather. So, which will lead to increased intake of water. Polydipsia. Now, apart from that, what is going to happen next? Because this person is losing a lot of water to the environment, it means the person is going to have a low level of blood called hypovolemia. Hypo what? Hypovolemia. Because the person is losing a lot of water, hypovolemia will set in, which means hypo means reduced or below. Volemia is volume of blood. Because water is one of those things that makes up the what? The body water. I mean the blood rather. So because the person is suffering from hypovolemia, it means there is no sufficient blood. There is no enough blood. So the blood volume is not high, and that is going to lead to what? It's going to lead to shock. It's going to lead to shock. Because shock is what? Ineffective tissue perfusion. So the tissues, the cells, they are not receiving the adequate amount of blood that they need. So the blood supply to them has been interrupted. So hypovolemia is one of the causes for shock. So the person can have shock and then go unconscious. And that is what? Hyperosmolar hyperglycemia syndrome. Now a quick recap on hyperosmolar hyperglycemia syndrome. It is because of what? Hyperglycemia. So because of hyperglycemia, the person is going to have increased osmotic pressure, and that is going to lead to what? Withdrawal of water from different body parts, different tissue spaces into the what? Into the blood. And this blood is going to flow to the kidney, and the kidney is going to be passing it out. So that clinical manifestation is called polyuria. And because of polyuria, the person will be feeling excessive thirst, and then that is polydipsia. We're drinking a lot of water. So the person presents the sign and symptom of dehydration as well. And because this person is losing a lot of water, it is going to cause hypovolemia, because water is one of those things that forms the blood volume. So hypovolemia is going to result in shock, and that can lead to what? Unconsciousness. Now I'm going to come back and give a quick recap on both DKA and HHS. Just stay tuned. Yeah, welcome back and thanks for staying tuned. So for today we talked about the DKA and the HHS. So for the DKA, the diabetes ketoacidosis, we said hyperglycemia, which is increased amount of glucose within the blood, is going to lead to what? It's going to lead to dehydration. We talked about that under osmotic diuresis. But we said because the glucose cannot be picked up by the cells, the cell is going to be breaking down their what? Their fat stores. And when they are breaking down their fat stores, they are going to be forming fatty acid within the blood, and then the fatty acid will converge in the liver, and ketogenesis will occur, which is production of ketones. And then these ketones, they are poisonous, but still our body uses it as a form of energy. So with recurrent deposition of ketones, recurrent formation of ketones, it's going to lead to what? Acidosis, because ketone is a weak acid. So it's going to tilt the body pH below 7, and diabetes ketoacidosis will set in. So I said the ketone is going to move out of the liver, just like through the hepatic vein, carrying it into the what? Into the inferior vena cava, then into the heart. And the heart will have to push the blood to lungs for oxygenation. And during that process, the volatile part of ketone is going to escape as acetone. So the person is going to have a sweet or fruity smell. So apart from that, the blood is coming back to the heart and then pushed into the systemic circulation. At the arc of the aorta, the blood is supplied to the other part of the body, which the brain is inclusive. And then, because the brain has a center called the medulla oblongata, it is going to increase the person's respiration, and that will lead to what? They call mouth respiration. And apart from that, the blood is coming back to the what? To the heart. Okay, sorry. The blood is going back to the descending aorta now. Then into the thoracic aorta, then into the abdominal aorta after the diaphragm, below the diaphragm, and then to branch into the what? The right and the left renal arteries. So that is going to supply the what? The kidney with blood that contains what? High level of ketones. So the person is going to have ketonuria because the kidney is going to form urine. So and the person is going to urinate ketones out as well. So after that, I said the presence of ketones within the body system will lead to some certain things. So it is going to bring about vasodilation to the what? To the blood vessels. It irritates the nerves of the blood vessels, and then it will lead to vasodilation. And vasodilation with time is going to lead to shock. And after leading to shock, the person will go unconscious. So that is that for the DKA. But for the pathophysiology of the HHS, Hyperosmolar Hyperglycemia Syndrome or Hyperglycemia Hyperosmolar Syndrome, we said hyperosmolar means increase in osmotic pressure. That is a pressure that draws fluid into the blood vessels. So it draws fluid from the tissue space. So the person is going to suffer from what? Is going to suffer from dehydration. So I would say this is occurring because of what? Because of hyperglycemia, increased amount of glucose. So I said glucose performs the function of what? Osmotic diuretic. After drawing the fluid into the blood, diuresis is going to occur. The person is going to lose the water through urine, and the person is going to have polyuria, signs of dehydration, and then the person also have polydipsia, increased intake of water. And we said this is the complication, an acute complication of what? Of diabetes type 2. So I take it you really enjoyed this video. So if you do make sure you give it a thumbs up, and if this is your first time watching a video from the SSG Nation, do make sure you subscribe and you hit the bell button so we can notify you whenever we create a video. Guess what? I'm just signing out. Hi guys.